Hello friends, today let's talk about alcohol. Humans have been consuming fermented beverages over the past 10,000 years. They've also been debating its merits and demerits. Suffice it to say, alcohol is both a toxin and a tonic. Well, let's start with the dark side of alcohol. Increases risk of cancer, especially breast cancer, causes circulatory collapse, liver-related death and liver failure, higher risk of depression, poor mental health, and in fact 50% of mortality related to road traffic accidents in America are caused by alcohol. The beneficial physical and social effects of alcohol cannot be completely refuted. After a tough day, a drink can be a soothing respite. An occasional drink with a friend can be a social tonic. It also improves one's HDL cholesterol, therefore reduces risk of heart attack and cardiovascular death. It improves insulin sensitivity, therefore reduces risk of type 2 diabetes and can reduce the risk of gallstones. How much of alcohol is moderate? Well, for women it is about 1 drink a day. For men it is 1 to 2 drinks a day. A drink constitutes 12 ounces of beer, or 1.5 ounces of spirits, or 5 ounces of wine, which is roughly equivalent to about 12 to 14 grams of alcoholic content. How you drink, or the drinking pattern, is very important. Binge drinking is not good. So in other words, if you drink 7 drinks on a Saturday, it's not the same as drinking 7 drinks spread out over a week. Balancing based on individual factors is also very tricky. For example, if a person has a family history of alcoholism, stay away. If you don't have any history of a heart attack or heart disease in the family of type 2 or type 2 diabetes, and you eat healthy and stay active, alcohol is not going to add any much to your health. So stay away. So you do not need to start drinking to reduce your risk. In other words, if you're a 60-year-old man with a higher risk of heart attack because of family history or type 2 diabetes, a drink a day may mitigate that risk. For women, there is more balancing that needs to be done because of risk of breast cancer and heart disease. Women are more concerned about breast cancer, even though the risk of heart disease and death from heart disease in women is much higher. Folate deficiency is an important risk factor which is concomitant with alcohol causing cancer-related risk. Therefore, 400 milligrams of folate should be consumed if you drink alcohol. The most common sources of folate are eggs, asparagus, Brussels sprouts, or broccoli. Finally, if life gives you a lemon, put some vodka in it. Take care, stay safe, keep smiling. Thank you so much for listening.